Well, that was in Calcutta a couple of days ago, people getting on a bus. Welcome, it's Friday the 12th of June. And we know there's a lot of disease around in India already. And we know it's spreading, and that means the spread is guaranteed. Now, things didn't get a lot better once people got on the bus. Let's have a look at that. So I think we can see that social conditions there are causing difficulties, to put it mildly. And I want to look at Brazil as well. Now, this is the situation in Brazil a couple of days ago. So we see busy commuter trains. Streets which look basically busy and normal, apart from the fact that the people are wearing masks. Fairly busy commuter station again. You'd have to say these streets look normal apart from the mask wearing, really. Busy commuter train. Normal looking streets. So things are looking basically pretty normal there. Now, the last pictures I want to show you this morning are from the Philippines. Now, this is from the Philippines, again, in the last couple of days. Now, there's some new legislation being introduced in the Philippines called the Terrorism Act. And a lot of people are opposing it. I don't know the details of it, but you can see a lot of people are opposing it. And they're practicing their democratic right to demonstrate. But can you see it's being done in a highly disciplined way with social distancing? All these people were wearing masks. So a highly disciplined demonstration there in the Philippines. And again, this demonstrator is clearly protecting himself and others. And these ladies here, again, protesting in a very dignified and socially distanced way. So all very encouraging to see these dignified protests. And we could mention that other protests in other parts of the world have not been as well disciplined, where there will be spread, whereas those demonstrations in the Philippines spread is unlikely. So we've seen chaotic situations in India and Brazil, and we know that in Brazil the condition is already widespread and causing a lot of problems. In India, the cases are increasing greatly, and hopefully you saw yesterday's interview with our Indian academic who explained a lot of things very clearly for us. Now, let's go on and look at some other areas I'm concerned about. Africa. Now, it took 98 days to get the first 100,000 cases in Africa, and 18 days to get the next 100,000 cases, and these are official cases. So we are now at 200,000 cases in Africa. And there's community transmission in more than half of Africa's 54 countries now, according to the World Health Organization. So we've got community transmission. In other words, the virus is spreading without obvious epidemiological links. The COVID-19 virus is spreading to rural areas. This is the official number of deaths, but of course it's a gross underestimate. And the World Health Organization say that 50% of workers in Africa are daily wage earners. Now, this is so important because it means that these people eat that night what they earn that day. So for them, locking down will mean they go hungry. And that applies to half of the population of Africa. So there is intrinsic difficulties here. Now, the World Health Organization say there could be 3 million deaths if there's sustained community transmission in Africa. And there's going to be a steady increase in Africa until a vaccine is developed, according to the World Health Organization. And the current hotspots are South Africa, Algeria and Cameroon. So we have the potential for 3 million deaths in Africa here, according to the World Health Organization. And there is going to be an increase until the vaccine comes along. Now, the response to this, according to the World Health Organization, is that we require very strong public health measures. And this is the Africa director of the World Health Organization. Now, Senegal, for example, I saw a news report on Senegal. People are mingling freely, there's community transmission, and the health services are already full, so it's going to get even fuller, if that were possible, which it probably isn't. Now, South Africa, this was very interesting. Now, South Africa, we looked at some useful data yesterday from South Africa, from the Western Cape, the health authorities there. 3.5 million adults receiving healthcare in the public sector, and 12,987 of those diagnosed with COVID-19, and 435 have died. This was the basis of this study we looked at yesterday. But I've just got a little more detail, because what the South African health authorities have done here is they've quantified the effect of comorbidities, and this just doesn't seem to have been done anywhere else. I just wonder why not. I've never seen any figures for this in my country. I don't know why not. We've seen some. For example, this. Men are 40% more likely to die of COVID-19 than women. 40% more likely, hazard ratio 1.4. So men 40% more likely to die from women in the Western Cape in that data. Risk of death increased in each age band over the age of 40, as we've seen, of course, in other countries. The same is true in South Africa. Now, these are what concerned me yesterday. People with well-controlled diabetes were 4.65 times more likely to die than someone without diabetes. Someone with uncontrolled diabetes, 13 times more likely to die. Someone with high blood pressure, 1.46 times more likely to die, although we don't know whether that is affected by the degree of control. Although clearly we see here that if someone's got diabetes, their odds of getting severe disease and death are much less if the diabetes is well controlled, but still quite high. People with chronic kidney disease were twice as likely to die from COVID-19. People with a previous history of tuberculosis, 1.41 times more likely to die, and people with active tuberculosis, 2.58 times more likely to die. HIV, they're 2.75 times more likely to die. But the level of viral suppression in HIV didn't seem to make a difference, which is very surprising. But it's what the data shows. And almost all people who have HIV who died had other comorbidities apart from HIV. So this does complicate the issue somewhat. So for example, about half were diabetic and about half were hypertensives. But overall, this doctor in charge of this study in South Africa, this was Dr. Marianne. Where is she? Dr. Marianne Davies. She said that we're quite reassured that this number is not enormous. This is talking about the number of people with HIV who died. But people with HIV need to be on the list of risk groups. So clearly the case, and remember there's over 8 million people in South Africa have HIV, which it was a concern. Now, that's what I wanted. There we go. So this is the app that's being introduced in New York. So if people from New York are contacted by the health authorities, answer the phone. Other people, you have the option whether to pick up or not. Pick up's a bit of an old-fashioned term. We should really say press the green button now for mobile phones. Right, sorry, my technology is a bit all over the place today. Right, now, what I wanted to do now is look at some more information from the United States, having looked at that. Anthony Fauci, who we know well now, Concerned about recent mass protests. Fair enough. He's publicly expressing his concern about mass protests. Is publicly expressing concern about spread of the virus because of lack of social distancing during mass protests. And also, members of the Washington District of Columbia National Guard have tested positive. Now, I don't know how many, but Anthony Fauci described this as disturbing, which I would certainly agree with. Now, the members of the National Guard have been tested. What I don't know is how many of the protesters have been tested. So it could well be that there's a whole large number of protesters who have not been tested, who have the virus. That is quite possible. But in Boston, Boston's offering COVID-19 protesters... Boston is offering people who've protested recently COVID-19 testing. And that's Marty Walsh, who says he's reaching out to organisers of the demonstrations. So the people that are organising these demonstrations, whoever these people are, have been contacted by Marty Walsh to encourage their people that they are organising to get tested. And I would encourage anyone who's been to these mass protests to get tested, because there's a very good chance that you've been infected. And as we know, that the members of the National Guard who were also there are testing positive. So do please comply with that basic public health measure and get tested if you have been protesting recently in these mass events. Mobile pop-up testing site in Boston for symptomatic and asymptomatic. So in Boston area, whether you're symptomatic or asymptomatic, you can just pitch up and you can get a test. Why not do that? If you do that, you could save the lives of other people. So I would really encourage you to do that. This example is from Boston, and I believe this will be in other places as well. Now, better news. The US National Institute for Health and Moderna vaccine. This vaccine. Now, the phase 1 trials have been completed and they appear to be successful. The phase 2 trials have been carried out and the data from those is just being analysed now. So phase 1 was 45 healthy volunteers. Phase 2 was 300 volunteers. Phase 3, they're recruiting 30,000 participants. And these aren't all young healthy people anymore. These are the elderly. These are the people with comorbidities. This is a more proper clinical trial. So they're recruiting 30,000 participants now. And providing the data from the phase 2 trial is good, that trial will go on, and that will be in July. Now, it appears this vaccine is making really quite remarkable progress. So the two vaccines that seem to be ahead of the field now are the Oxford AstraZeneca one and this US National Institute of Health and Moderna vaccine seems to be ahead of the field at the moment. So this is really very encouraging that this vaccine seems to be progressing so quickly, and to get to phase 3 clinical trials in such a short period of time is a world record, of course, and it's looking fairly promising. Now, Matt Hancock is the Secretary of Health in my country, and he said people should not attend demonstrations for public health reasons. So here we have the guy who's in charge of health in the country advising people not to attend. It's a virus that thrives on social contact, he says. Having said that, we are reopening shops on Monday as part of the reopening strategy, but with very good precautions in place in virtually all retail situations. Now, Ireland. Now, I'm giving Ireland a shout out today for a very impressive achievement. The prison services have had no cases whatsoever. And the prison services in Southern Ireland, in Ireland, submits best practice paper to the WHO after no inmates test COVID-19 positive. So my unconditional congratulations to the prison services in Southern Ireland. Very impressive achievement. Despite fairly large amounts of cases in the country, the prison services have had none. So that's excellent. Now, we started talking about Russia yesterday. Now, the World Health Organization have said, this is not me, this is Russia. Russia's official coronavirus death rates are difficult to understand. So the World Health Organization is struggling to understand Russia's data. They're being very polite, aren't they? 6,532 deaths are many times lower than other countries with serious outbreaks. So the death rate in Russia is way, way lower. Way, way lower than the World Health Organization would expect. So that gives two options: that Russia has been spectacularly successful in preventing serious disease and deaths, or these figures are less than accurate. I'll let you choose which you think is the more probable situation. I'm reminded of 1986, the Chernobyl disaster. Most of you are probably too young to remember, but there's been an excellent drama on it recently, and it was the Chernobyl disaster that was largely responsible for the downfall of the Soviet Union, as was then. It was one of the triggers anyway. And I think there's memories in Russia of that time and the fear of political change that could be brought about by such events. And of course, the COVID-19 pandemic is such an event. So death rates in Russia, if the World Health Organization and their experts don't understand it, I have no chance, but you might understand it. European Commission. Russia and China have mounted targeted influence operations and disinformation campaigns in the European Union and its neighbourhood globally. So the European Commission are going further and saying that Russia and China have actually mounted targeted influence operations and disinformation campaigns. Disinformation campaigns in the EU and its neighbourhood and globally. Not my words, that's the European Commission. So I'll leave you to decide how accurate you think this data from Russia is. And if you decide this data from Russia is not very accurate, then that means we need to spend some time to remember and have the suffering of the people of Russia in our thoughts at the moment, and indeed in our prayers, if that's what you believe. I believe the people of Russia are suffering quite significantly at the moment. Now, this is illustrated by Dagestan in the bottom left-hand corner, so that's the southwest of the Russia. Now, the Dagestan health minister was on local TV talking about the number of infections, and they were at least 4 times higher than reported, because there's many deaths that are reported as CAP. Now, CAP is a well-recognised condition. We have it all the time in accident and emergency departments. It stands for community-acquired pneumonia. And there's been a massive increase in the deaths of community-acquired pneumonia in Dagestan. So the numbers that the Minister of Health in Dagestan put forward were 657 deaths. The official numbers were 29 deaths. And then that was corrected by more central sources. So it looks like the regional leaders wanted to appear in control, but in this moment of candour we learned that there was quite a few deaths, 657 versus 29, that died mysteriously of community-acquired pneumonia when there just happens to be a COVID-19 pandemic. Now, India. As we've seen, the cases are greatly increasing in India. And we know they're massively underreported because of the virtual absence of testing in huge areas of India. Mumbai, New Delhi, Chennai, epicentres, deaths are increasing. Most Indian states have now lifted lockdown restrictions. Train services partially restored. Shops and manufacturing reopening. Subways, hotels, schools remain shuttered nationwide. So subways, hotels and schools remain closed, but as we've seen, the buses there were quite busy. Now, just before we go on to look at the final country I want to look at today, which is South Korea, some encouraging news from Greece. So this is the Greek. This is a newspaper in Athens. Clearly this is the English language version of that newspaper, and I was just encouraged to see some public awareness in the lovely, historical, culturally significant country of Greece. So that was a moment of encouragement in today's news. Now, South Korea. Now, this is interesting. South Korea, 45 new cases per day, having virtually got rid of the virus. Mostly in the Seoul metropolitan area. And the health authorities have struggled to trace the transmission. In other words, there's some ongoing community transmission. Now, it's at a very low level, and the Koreans are dealing with it. But if the virus hasn't gone away in Korea, a country that did so well, then it's not going to go away from the United Kingdom or the United States anytime soon, I'm afraid, because it's still there in Korea. Now, I have here an excellent film from Japan that's been circulating on Japanese media, Japanese social media. So I want to share that with you now because it's got some very important information in it.
This lab is simulating the movement of microdroplets in an airtight room. About 10 people in an enclosed space the size of a classroom. A person coughs once and spreads about 100,000 droplets. Large droplets are shown in blue and green. Most of these fall to the ground within 1 minute. But the microdroplets shown in red continue to drift. This simulation uses only microdroplets. 5 minutes later, 10 minutes later, "20 minutes later, the microdroplets are still floating in place.
So we see how important it is to have good ventilation. If that space had been outside or well ventilated, then perhaps none of those people would have been infected with any significant dose. So we need good ventilation, especially inside and in indoor closed spaces. And that also shows us that this idea of being in contact for 15 minutes is a bit arbitrary and quite inaccurate, really. It shows the people that are in closest contact, just a metre or 2 metres or 3 metres away, can be infected within minutes. And it gradually spreads out from there in these micro droplets in the air that carry the virus into other people's respiratory mucous membranes. And I think what that also shows is the absolute pivotal importance of people wearing masks. If that infected person had been wearing a mask, then the air would not have had that momentum, and it wouldn't have sprayed out and infected all those other people. So remarkably useful animation there, I think. So what we have to do now is look at some of my favourite people of the day. And this is Barbara, who does some sort of clever things with needles and thread and stuff while she's watching. So I'm pleased to see in South Africa, Port Elizabeth. And there is Barbara indeed, with her cat watching in South Africa. Delighted you're watching, Barbara, in South Africa. And I admire your skill here. I wouldn't have a clue. This is Forrest, who watches in California. We can just see him there behind his rather frightening pirate mask, but it will do the job. It will stop the infection spreading. This is Francisco, who looks like he's watching on the job here in Barcelona. Good to see that you're watching in Barcelona, Francisco. Thank you for watching, taking time out of your obviously busy daily schedule. This is Gavin in Gloucestershire, which is in the United Kingdom. So glad to know you're watching, Gavin. Thank you for watching. Oh, now this was from Jeanette in Finland, in Finnish Lapland yesterday, and I meant to share it yesterday. And I think it's showing that the milk is fortified with vitamin D. Let's just go in and have a look at that. Yeah. Where is it? Here we are. D vitamin. And it's fortified. So D vitamin, right, so it's 1 microgram of vitamin D per 100 mils of milk. So that's very useful to know. And of course, there's a lot of awareness of the importance of vitamin D in these northern countries like Finland, Norway, Sweden. And that is explaining partly why they are having lower incidence of the disease, I believe. Now, getting back to the pictures. This is John Richard, who watches in Peru. Now, I think John is teaching English in Peru there. But anyway, I'm glad to see you're watching in Peru. Never been to South America. Probably never get there now, but I would love to go. This is John, who watches in Shrewsbury, also in England. Thank you, John. Glad to see you're practicing your masking technique. This is Nadira, who watches in London. Let's have a look. You're a long way away. There we go. So Nadira, who watches in London. Thank you for watching. This is Nick, who watches in Inverness. Oi, Nick behind you. Oh, this is me talking. I know what you're thinking. Take vitamin D every day and wear a mask in enclosed public spaces. Keep watching now. I've lots more information to share. Excellent sentiments, Nick. And a very good paraphrase of me, I think. So glad to know you're watching up there in the North Country. This is Uno, who watches from China. So clever, this Chinese writing. Amazing. Okay, that's us for today. Thank you for watching.